teaching client to use incentive spirometer. What is the goal? The goal is the patient will demonstrate the procedure using the incentive spirometer. Number 1, review the chart for any health problem that would affect the patient's oxygenation status. Next, bring the necessary equipment to the bedside stand or over bed table. Perform hand hygiene and put on PPE if indicated. By the patient, we can identify the patient by asking their name or the wristband, the door that indicate the name of the patient. Close the curtain around the bed and close the door to the room. If possible, explain what you are going to do and why are you going to do it into the patient. Next, assist the patient in an upright or semi-fowler position. If possible, remove dentures. If they fit poorly, assess the patient's level of pain, administer pain medication as prescribed if needed. Demonstrate how to steady the device with one hand and hold the mouthpiece with the other side. Then, if the patient cannot use one hand, assist the patient with the incentive spirometer. Next, instruct the patient to inhale normally and then place lips securely around the mouthpiece. Instruct the patient to inhale slowly and as deeply as possible through the mouthpiece without using nose. If desired, use a nose clip. Next, when the patient cannot inhale anymore, the patient should hold his or her breath and count to 3. Check the position of the gas to determine progress and level attained. If the patient begins to cough, splint, an abdominal or chest incision, remove lips from the mouthpiece and exhale normally if the patient becomes lightheaded during the process. Tell him or her to stop and take a few normal breaths before resuming the incentive spirometer. Next, encourage the patient to perform incentive spirometer 5 to 10 times every 1 to 2 hours if possible. Clean the mouthpiece with water and let it dry. Then remove PPE if needed. So when do we need to use PPE? When a client has a communicable disease or to be exposed to their body fluids. Then next, perform hand hygiene and document.